Okay, so it looks like we're about at time. People still just trickling in a little. So let's go ahead and get started. So welcome everybody. So just one announcement before we get started. So please attend and support our students next week at the seminar. They'll be giving their lightning talks and presenting their research. So it would be great to have a high attendance for that and give them all our support. And today I'm happy to welcome our host and the person who organized this wonderful panel, Dr. Heather Hill, who is a professor here at UW in the Evans School. And I'm going to turn it over to her to let her talk about her panel and the speakers that she's invited today. And again, please put all of your questions in the Q&A. And you can do that as you think of them, but at the end, then we'll manage it together and I will go ahead and allow you to talk, to ask your own questions so we can have more conversation. So with that, thank you again so much, Dr. Hill. I'll let you go ahead.
Thank you, Maria, and thank you everyone for joining us today for this important and timely discussion about the effects of the pandemic on children and the effects of the economic and policy responses on children as well. Can I get a thumbs up that you're seeing my slides and not other things? Okay, thanks. So as a moderator today, I'm going to briefly introduce this topic and our panelists before posing a set of questions to the panelists. We'll have moderated discussion for about 30 minutes, and then we'll stop and open up for Q&A from you all and try to reserve about 25 minutes for Q&A. And as Maria said, your questions can go at any time into the Q&A function at the bottom of your Zoom screen. Please use that instead of chat. And when we get to that point, I'll encourage you to indicate whether your questions for the panel overall or for a specific panelist. But first, let me just provide a little bit of context about the scope of this issue, which I think is going to be familiar to most of you, but I thought it was a good starting point. So COVID is the pandemic, and the economic and policy responses to the pandemic have implications for children in a lot of different ways and domains. First, children are, of course, getting COVID. About 12% of the cases nationally are children, and that percentage varies quite a bit by state. So in Washington state, 15% of our cases are children, but in Wyoming, 23% of the cases are children. Most children are now doing some online learning, which would have been quite rare for your sort of standard school day learning pre-COVID. In the most recent census household pulse surveys, 65% of households with children report that their children are doing some online learning at home. This is quite a bit higher in Washington state, where it's close to 85%. Children are also being affected by high parental unemployment rates and the material hardships that follow from reductions in employment and income. Just one example here, in the most recent household pulse survey, nearly a third of households with children are food insecure, reporting that they don't have enough food and are having to skip meals or eat insufficient meals. Importantly, as striking as each of these statistics are, for every single one, there are large racial ethnic disparities in the rates. So COVID is really mirroring and amplifying racial and economic inequality that existed in our country already. So to consider such a problem of such huge scope, the effects on children of this health crisis, which has also led to an economic crisis, and a real challenge to schooling and other contexts of child development, we wanted to bring together a multidisciplinary panel of experts. And so today we'll be hearing from 3 panelists. The first is Dr. Emiko Tajima, Associate Professor in the School of Social Work and the Executive Director of Partners of Our Children, which is a public-private partnership focused on improving outcomes for vulnerable children, particularly families touched by Washington's child welfare system. Second, we'll hear from Dr. Lily Lengua, professor in the University of Washington's Department of Psychology and director of the Center of Child and Family Wellbeing at UW. Dr. Lengua studies the effects of adversity on children and specifically the risk and protective factors that shape children's resilience and vulnerability. And last but not least, Dr. Anissa Ibrahim, who is a pediatrician, clinical assistant professor of pediatrics at UW Medicine and the director of the Harborview Pediatric Clinic. Her clinical interests include and focus on care and outreach to immigrant and refugee populations. So thank you to the panelists for being here, for taking time out of your busy schedules, for dealing with internet challenges and juggling all the things that you're juggling. We really appreciate it. I'd like to start by posing a few questions to the panelists and asking them each to respond. First, if you could describe a bit about, for the audience, a bit about the focus of your work pre-COVID. What were you thinking about? What were you focused on in the work you were doing? And then how has that changed, if at all, during the pandemic? And I wondered if we could start this one with Dr. Lengua.
Thanks, Heather, for putting together this panel. I'm really honored to be sitting here with all of you. Thanks for the opportunity to share a little bit about our work. As you already said, my research focuses on the effects of adversity on kids. And in particular, we're interested in trying to understand which children can emerge from stressful experiences resilient and which ones emerge vulnerable with mental health problems or psychopathology or social, emotional, behavioral problems. So we've been examining factors that are represented in their context, their broader community context or their family socioeconomic context, as well as family factors, parenting behaviors, and even child individual differences as they relate to physiological stress responses, coping responses, and then ultimately children's adjustment. And so during COVID, it really represents both a burden and an opportunity to our research. So a couple of our ongoing studies had to stop altogether, or we've lost data from in-person assessments. On the other hand, we did have these ongoing studies and we have pre-COVID data on families. We understand their economic and social context, their family context, and their prior mental health. And so that's been it's given us the opportunity to look at then what have been their experiences because of COVID, the changes in their economic context and social context, and ultimately their changes in their mental health. So it's both an opportunity and a cost. We had an ongoing study looking at young moms and their developing infants. And we also had an ongoing study where we've been studying these families since the kids were 3, but now they're 14. So we've also been able to look across the developmental spectrum at how families are faring and how the child and parent mental health response looks. So in many ways, COVID presents an opportunity to study what we've already been studying, but to be able to look at how changes in those contexts are affecting families.
Thank you. Dr. Tajima?
Hi, everyone. My work is focusing on the child welfare system, and I would say pre-COVID, I characterize the work as working on trying to reform child welfare practice, thinking about how to help children and parents to maintain bonds where children have been placed in out-of-home care, thinking about how to increase the engagement of parents involved in child welfare services, thinking about improving reunification rates where we can do that, and advocating for prevention. And because the child welfare system has seen incredible racial disproportionality for decades, it's something that we've been examining, the racial disproportionality and sort of where it was occurring and that sort of thing. And I would say that post-COVID, it's been a shift in child welfare and in researchers and policymakers thinking about child welfare, from reform to really transforming and re-envisioning child welfare, thinking about child and family welfare, thinking about shifting to how to support families and shore up families, and prevent removals, and just really rethinking it altogether. And I think it is, we've seen more openness on the part of legislators and community members and others to thinking about preventive interventions like income transfers for families. And I think we're kind of thinking about post-COVID, but it's also the fallout from COVID, as well as post George Floyd, post defund the police, and a real reckoning with race and systemic racism in institutions in this country, police being one, but also in child welfare. And so it's really a time of kind of rethinking and re-envisioning child and family welfare from an anti-racist perspective. One thing that we've done at Partners for Our Children directly in response to COVID-19 is think about those system-involved families where children have been removed in Washington State. And in Washington State, when children are in care, the parents have visitation with their children, what's called family time. And we had already been focused on trying to support family time such that it would be engaging and supportive and help to maintain bonds. And we shifted when the governor announced that there would be no more in-person visitation in Washington State, that it all had to be virtual. We shifted to developing a supportive virtual family time model for visitation supervisors to use with children and families who are in care. So that's something that we sort of shifted to developing and offered a training and supports and tips and that kind of thing for virtual visitation, all with the hope of trying to maintain those bonds and reduce the trauma of separation, particularly in the context of COVID-19 and everything that's going on.
Thank you so much. And Dr. Ibrahim?
Yeah, so I think we have, as a clinician, I've really been doing a lot of the same work with a shift in how we are doing the work and the type of clinical care that we provide. Our clinic at Harborview, it's wonderfully diverse, but we do serve very socially and medically complex children and families. That includes, our foster care center of excellence. It includes our unaccompanied asylum-seeking minors. It includes newly arrived refugee and immigrant families whose worlds have really been turned upside down with the inequities, both in health and then that have then been magnified by the pandemic, specifically as it comes to food insecurity, housing insecurity, the digital divide. When we flipped into telehealth, we had a really hard time with that because we knew that it required many things, including money for Wi-Fi. It included needing to be literate in English. It included, sometimes to be technologically savvy. So many of our, we are a part of UW Medicine, and many of the initiatives that have been taken by UW Medicine, we did have to kind of apply an equity lens and really advocate for how and if we could apply this to our patient population, specifically the children that we serve. And if it wasn't equitable, what do we change to make it more equitable? I think, I did and do continue to do a lot of community engagement with community organizations. They do think health is really within the communities which our patients live. And there's a lot less of that in-person hands-on approach that we're able to do with COVID-19 with our families come from the 80% of the world who information exchange through oral cultures and oral histories. So brochures is not how you get to these families who are, looking for the same information that others are. And for a long time, the feedback has been, we like to talk about things. We like to, have people come into our neighborhoods and really sit down and kind of break bread to really get down to what we need. And I think COVID has really taken that social piece away. It's taken the ability to connect with families and really be there side by side with them with regards to community engagement. That approach has just changed. But I think there are many different things that we've been able to discover that the community has essentially recommended that have been working for us, including the approach to telehealth. And then I've started to do some COVID-based research specifically in immigrant communities with regards to how to get information to the communities, what's working, what's not working, and how do we partner with public health to make sure that information is getting to the communities that we're seeing the disparities in.
Thank you so much. It strikes me that as much as this is an extremely challenging situation for communities and families and for all the work that all of you do, you all described interesting opportunities for reform, for innovation, for research of different questions. And I think that's really amazing to see that that come out of such a crisis. Could you each talk a little bit about, based on your training and your research and clinical expertise, what are the consequences that you're thinking the most about in terms of the consequences of the pandemic for children? It doesn't, what's something that you're perhaps worrying about or thinking about wanting to make sure we're paying attention to? Maybe for this one, we could start with Dr. Tajima.
Sure. I think the consequence that I'm most focused on is increased risk to children of chronic neglect and physical and sexual child abuse, in large part because of the context that you described at the outset of this seminar, the economic stress that we know is a risk factor for child abuse, unemployment in the household, housing insecurity, and food insecurity. I think are all stressors that can accentuate the risk. Within the household, I think the limited childcare that's available, it's been available during this time, certainly increases risk, as well as schools being closed and children being homeschooled, just as you described at the beginning as well. Not having access to teachers who are also mandated reporters of child abuse and neglect, who are not having, who at least in the spring and over the summer didn't have contact with students, and now it's only virtual. The social isolation that's extreme and really unprecedented for families, and just so few social supports that can offer a respite and help for a lot of different factors for children and families. And I think another sort of element, particularly related to child abuse and neglect, is increased alcohol use during this time, risk of domestic violence perhaps being higher during this time of isolation, and untreated chemical dependency and mental health problems that I think also put kids at higher risk. And I'd say, some of the groups of children that I'm particularly focused on would be kids in poverty, extreme poverty in particular, Black, Indigenous, and Latinx children, LGBTQ and other youth, children with disabilities, and infants and young children, I think, are particularly at risk.
Thank you. Dr. Ibrahim?
In addition to the issues that Dr. Tajima raised, I am really most concerned about just pediatric mental health due to so many things that have changed for children in the past, 9-10 months now. I think with the extreme isolation, with the family stress that has occurred, the not being able to be around friends and others. I think we've seen a huge increase in just behavioral issues and depression and anxiety, specifically, or if there are many of the children in groups that have historically been marginalized are more likely to have family members who are sick, more likely to have family members who've died, more likely to have family members who are essential workers. So living with that consistent fear, I worry a lot about mental health. The other thing that I worry significantly about is school and children's ability to learn, and the differential in support and privilege that there is to be able to homeschool your kids and be able to help them. I think a lot about myself and my children, and how much I have to coach and help and answer questions on a daily basis, and think often about my families who are brilliant and resilient, but just don't have the capacity to do that for multiple reasons, including needing to work or not, having limited English proficiency. So I think we are going to be seeing the after effects of this learning that's going to increase the achievement gaps that we already are seeing.
Thank you. And Dr. Lengua?
Yeah, I think I mostly would echo our greatest concerns are the issues that have already been raised. Families that were already economically strained or in precarious housing or food situations. All the issues that have been already raised, families with parents with mental health, substance use issues, higher levels of conflict. I think the families that had these existing conditions, or even children who already were struggling with emotional or behavioral problems before the context, we're just seeing those problems exacerbated in these contexts. In addition, their own contexts are being exacerbated. In fact, the economic strain is getting worse, the food insecurity is getting worse. And so it's more that change and the prolonged nature of this. So, we often are asked, families are worried about, the social deprivation of their kids when there are more resources in that family. That's less of a concern. I would say that from what we know from research on adversity, major stressful life events, prior disasters in families, that most kids will weather those well when there's a safe, stable, consistent context and safe, stable, nurturing relationships, adult relationships, and caregiving relationships for those children. So I think we can think of most children weathering this context fairly well. And yet our greatest concerns are those that the contexts that people have already discussed. And we know that then those families are going to suffer the consequences of COVID or struggle through these changes for much longer, even after for the majority of families, the effects of COVID will fade. So again, it's just highlighting the already disproportionate disadvantage some families were experiencing, and that it will not only deepen it, but prolong those effects over time. I do also want to add that also children have unique ways of dealing with things. And so we know that individual differences in children's reactivity and emotions and self-regulation and coping can make a big difference as well. So we see some children who do tend to navigate these situations pretty well, but for a child who is already stress reactive, their responses are more intense and problematic.
Thank you all. I think that really nicely gives a sense of both the factors at a individual level, but then also the really important contextual and structural factors that could put children at greater risk in a variety of ways. For my last question to you, I wondered if we could talk about, build on Dr. Lengua's point about resiliency and what protects children. For each of you, given your training, what resources or contexts or relationships do you see as protecting children at this time, that may be helping children to be more resilient, that we also could be promoting through services and policies and other things? And Dr. Ibrahim, would you start with this one?
Sure. Yeah. So I think that positive relationships are always protective for children, and I think one of the in a positive, essentially positive family attachments, if those relationships are positive, I think the family unit and the resilience that comes with that, and the relationships that children are able to develop. We know that children are very adaptive. So I think those relationships are protective. I think that we really just must focus on strengthening of all safety net programs that we've had, and then introducing more programs that are going to alleviate these financial burdens, these economic burdens, these insecurities of food insecurity, housing insecurity, families being worried about whether or not they're going to be evicted or they're going to have food on the table. I think all of those safety net programs that we have had really need to be strengthened, and those families who are at most risk should get even more help. I know that, in general, when we talk about what will help promote child well-being, I think it is the same things that would promote pre and post-pandemic, but just magnified. So any of those insecurities and those social determinants of health, just really being able to address those on an ongoing basis. And I really do think that school, although I'm definitely worried about what will happen down the line with the achievement gap, I think that those social relationships, even if they are via Zoom, are really protective for children. I think that they confide in their teachers, their friends. Many kids, especially those who are of writing age, really, teachers have found ways for them to have kind of social hour, whether it's texting with their friends or sending messages. And I do think those relationships are protective because it gives them, one, a kind of a shared mentality of everyone is really going through this, and all the other kids, for the most part, are also, at home. But two, it allows them to have some kind of outlet other than just, being at home and not being able to do the things that they were. And it also allows them to get very creative. I think children are resilient. They're resilient and adaptive by nature, and I think they focus on especially the younger kids, like the day to day. All right. So if there's something that is not allowed, they come up with 1,000 other things that they can do. And I think really promoting that curiosity, that wonder, that what can we do in this room, our backyard, what is an activity that we can focus on, and really allowing for that one-on-one encouragement of that resilient nature are all things that I think give me hope that kids are going to be okay. But I can't stress enough how the importance of these safety net programs and really ensuring all of our families are being connected to it, regardless of their literacy level, regardless of the language that they are most proficient in.
Thank you. Dr. Tajima?
Yeah, I think thinking about the children and youth involved in child welfare services or at risk of child abuse and neglect, certainly the resources that we've been talking about throughout here are particularly protective, whether it be income supports. And I think one thing that's exciting is the openness to income transfers, the no strings attached financial supports for families. Resources like flexible work arrangements for parents can be helpful. Housing, like making sure that people cannot be evicted during this period of time. Nutrition benefits and food, and then relating to childcare. I think I'm particularly concerned about children with disabilities and infants and young children who may be at higher risk for child abuse or abusive head trauma, like with caregivers who really are not experienced caregivers, perhaps older siblings, others in the household who are not used to caring. And so ways of supporting childcare, offering some sort of respite or supports for parents during this time. Certainly trying to think about and address those various barriers to healthcare and mental health treatment. given this need for social distancing. But the technology access and internet connectivity, I think, can be helpful and protective for children, particularly in relation to their schooling. And then relationships. I think our focus has always been in child welfare is trying to reduce the trauma and maintain bonds for children and their families, their parents, their siblings, extended family members. And in this time of COVID-19 and social distancing, it's even more challenging to maintain those connections with friends, counselors, teachers, who play a really important role in children's lives, including relative caregivers. Some of our children in child welfare are with stranger foster care caregivers, but others are with relatives such as grandparents. And they struggle with caregiving during COVID-19, not only them being at higher risk, but also needing supports, financial and otherwise. And then one other sort of relationship area that we've been thinking about is how to use the supportive virtual family time that we're trying to help promote to build collaborative relationships between parents and foster caregivers. Because a collaborative relationship between them can reduce that trauma for children of being separated and support them in maintaining bonds during that separation time, and a way of maintaining relational permanence for children, even if their home is not in a permanent setting at that time.
Thank you. Dr. Lengua?
Well, I agree with everything that's been said, and it was on my list of things to say too, so I won't repeat that. But I will just say that absolutely, first and foremost, families' basic needs, housing, food, safety, need to be met. And as a policy, approach, that's just a foundation for all other well-being and for how long this is going to impact families and children going forward. When we're focusing on child mental health, both of my colleagues on this panel have already talked about the key and important factors. I'll just really emphasize parental or caregiver mental health a little bit more strongly. What we know from, again, research on adversity and natural disasters is that the parents' own mental health and emotional response is one of the biggest determinants of the child's. So just really recognizing the critical need for supporting caregiver mental health and well-being, and offering parent support around their parenting. And again, for all the reasons people have already talked about, people trying to work and get their kids through online school, and just really recognizing the stress parents, caregivers are experiencing. The other thing that I think, along with having safe and stable and nurturing adults in children's lives, extended family, teachers, as everyone's already mentioned, I would just also share that research is really showing this pandemic is taking a big toll on pre-adolescent, adolescent, and young adult mental health in particular. And those older kids are really struggling at a time when they would be individuating and differentiating from their families and growing more independent. They're feeling pretty trapped at home. And so that, thinking about ways to continue to support their age-appropriate development at that age, and staying connected with peers in some of our researches, in safely staying connected with peers and close friends is a really important contributor to the mental health of those older children.
Thank you. I want to open things up to the audience. Again, the way to pose a question is to write it into the Q&A function. There's a button at the bottom of your Zoom screen. Please indicate if your question is for anyone or for a specific panelist. I can read questions. We can also unmute you if you would like to ask your question, just indicate that. While people think about their questions and hopefully write them into the Q&A, I will just say that it's really incredible to hear all three of you talking about the safety net and income supports sort of front and center as someone who studies those programs, it's really incredible to hear such agreement across different areas of expertise. And I promise to the audience that I did not plant those ideas in anyone's minds. Anisha has a question. Anisha, do you want to ask your question?
Sure, yeah, I can ask it. I was just wondering if any of you know of any formal efforts of people informing school reopening, prioritizing the needs of children who are most affected by schools being closed and everything being virtual. And how, like, if you know of that, how that's going, because it seems like it's, as the pandemic has gone on, it's kids with disabilities. I see a lot of kids with disabilities and kids with IEPs. Their needs are getting sidelined even more and more, while I see other kids like sports teams practicing out on the field. And I'm just wondering, like, is anybody doing anything about keeping the needs of these kids in mind in terms of reopening?
Thank you for the question. Does anyone want to take that?
I'm not aware of any particular advocacy on that issue. It's critically important. And we do know from a national survey that families with children with disabilities and special needs and IEPs, not only are their kids' needs not being met adequately, but it's also contributing to significant mental health concerns for the parents and the children. So it's a tremendous concern, and I'm not personally aware of any efforts in that area.
Yeah, similarly, I'm not aware of any kind of strategic efforts or that are happening at any local, regional, or national level. I know that many pediatricians have advocated strongly with school districts, saying that we do need to have supports, and if there's going to be some kind of hybrid model, then there needs to be prioritization of those same populations that you just mentioned, Anisha. Saying, let's get our children who have disabilities or need therapies or have IEPs into the school first, and then do a targeted approach. So I know the Washington chapter of the AAP has a pretty strong legislative advocacy arm, and I know that the folks there have been thinking about it, but I just don't know if there's like a specific strategic plan or a blanket way that they've been doing it.
I'll just add, I haven't been involved in it either. I'm aware of some guides for educators who are working virtually, trying to think about how best to connect with different subgroups of children with particular needs in a virtual context. But I haven't been part of advocacy around thinking about sort of staging returns to in-person schooling.
Thank you
so much.
Other questions from the audience? Blake has his hand up. Maria, can you allow Blake to ask his question?
Hi, can everyone hear me?
Yes.
Great. Well, first of all, thank you all for being here. I didn't type this question because I think I'm still working on articulating it in my mind. But from everything you all have said, it sounds as though there's a lot of research and need for many programs, and it seems like the evidence supports it. So I suppose I was wondering, what sort of hurdles need to be overcome for some of these policy implementations to take place, or what are some of the barriers that you have found or believe there to be existing? Thank you.
I guess I could
please.
start us off anyway. And I think it's a good question, because we've been talking about prevention and offering evidence for prevention for a long time. It's sometimes mind-boggling that that's not pursued. And I think there's a lot of different factors that could be going on. I do think that what's happening now, part of the reason anyway, that it's being discussed in a much more openness, I think that it's sort of a once in a lifetime, my lifetime anyway, opportunity to think about structural impacts on families. And I think in this country, there's sort of a dominant myth of individualism and self-sufficiency, and this myth of meritocracy. And if you work hard, then you succeed, and that's because you've worked hard and you've put in everything. And if you don't succeed, that's because you haven't worked hard enough. And I think something like the pandemic, like the Depression in the 20s, kind of normalizes economic insecurity in ways that maybe make everyone realize, okay, I see what structural racism means, or I see what the structural forces, how that can be at play with no fault of their own. So I think that opens the window, as it were, I guess, for the conversations. But it is a bit baffling and frustrating that it takes that to have these discussions.
Other thoughts from the panelists about barriers to reform or to expanding programs, or kind of following the evidence to protect kids in the way that we know can work?
I will just add that I think it is just a certain level of, in many places, it's a certain level of this, it's the way it's been done and it's been somewhat effective and it's good enough. In other places, it's really having a hard time, coming to terms structurally and institutionally with the fact that there has been structural and institutional racism whose after effects we are seeing now. And despite the people within the organization wanting to advocate for significant change, being asked to move at the pace of the organization, which I think, at least to me, is very much code for that's big and we just can't, or we can't do it yet. Because it's a lot of uncomfortable conversations. I think talking about these institutional racism or structural racism that has consistently damaged people of color is hard and uncomfortable for many people to talk about. That being said, it's harder and more uncomfortable for the people who have been the victims of it for far too long. So I think it is, this almost institutional complacency where, the people who are doing the work are fired up and they want to change these barriers, they want reform, but those are big, scary words to many people, and it makes them uncomfortable. And as human beings, we avoid what makes us uncomfortable.
Well said. So I'm going to read a question from Professor Jenny Romick in the School of Social Work. She says, let's think ahead to 2025, 2030. How might demographers and other related scholars understand this period in hindsight? And what do we need to do now to lay the groundwork for that? So looking forward, how do you think we'll understand this period in hindsight? So I guess it's looking backwards. And what can we do now to lay the groundwork for sort of being able to understand what's happened?
I will say briefly, if we're just looking at, if the question is asking, what are they going to understand from what we saw happen and the effects of the pandemic? Honestly, I don't think that a lot of this should come as a surprise, right? Like if you look at the data and the evidence, despite the media calling it a great equalizer, anyone who works with families know that no pandemic is an equalizer. It is equal in infecting possibly, but every single community has a different risk. So an essential worker who has to go to work, who has no protections at work, who is the sole employer, who doesn't have medical insurance, is obviously going to be affected by this virus and the pandemic and the regulations than other people. So I think one of the things, many times I think this data and this hindsight will prove what we already knew, right? Like that the morbidity and the mortality and the negative effects and the economic stress will fall along the fault lines of those who have been marginalized, and those who have, who are poor, those who speak a language other than English at home, those who have been victims of structural and institutional racism. So I'm not sure that they're going to be surprised, but I think that data is key. And especially, I think about this a lot as both a community physician, but also an academic pediatrician, in that many times you have to have the data to get people to listen to you, despite me saying, of course, people who speak a language other than English at home are not getting information. Some people need data for that, right? So what might be intuitive to many of us, many people need data to physically look at. So I think data is important in collecting data and looking at the data and seeing who's missing in this data set, right? When I send out a survey in English about the stress of COVID, who am I not getting, right? The people who really do need to be represented are the people that we're not getting. So those are just kind of my thoughts. And it just, many times when we think about these data level questions, I think a lot about, this is the data, and if there's a discrepancy and a disparity already, you can multiply that by X number by the people who are not represented in that data set.
I wondered, Dr. Lengua, if you want to say a little bit about the study that you're part of with others at UW to collect data on families during this period, and sort of how you're thinking about what information, with finite resources and time and everything, what information are you focusing on collecting now?
Yeah, that study, well, I did want to, I think Jenny added a little note to her question, thinking forward to developmental sequelae and outcomes. And if I could just say something about that
Please.
Quickly. I mean, I think what everyone is saying is that that the pandemic is really emphasizing and amplifying and highlighting things that we already knew and that we have years of research showing. And this gets a little bit back to Blake's question. So why haven't we done anything about it? And will the pandemic give us an opportunity to say, indeed, these things we've known this for a long time and we can make a big difference going forward. And thinking about developmental outcomes for children, that this could have lifelong implications for children who fall behind in school. We know if they fall behind in school early, they're more likely to drop out of school with lifelong implications. If they have mental health concerns early and behavioral and conduct problem concerns in early childhood, they're more likely to have those well into adolescence. So I think that we really should be concerned about these long-term implications, and how are we going to look back in 5 years and say, did we do the right things? And I just can't help but bring up the political issue here, that we're really struggling in a context where people are not only disagreeing about economic policy to address these issues, but we won't even have agreement that the pandemic is real, that coronavirus is actually not a hoax, right? And so I am concerned about that challenge, that we're overcoming a tremendous challenge of the reality of the pandemic in the first place, let alone trying to put in place policies and supports for families that will, even though we know from evidence that these are going to have lifelong implications for kids. So that's not a very hopeful message. I don't know what to say about that other than for us to use our advocacy and our research and our power and our votes to continue to make sure that that families are supported. There's an idea of targeted universalism. People are really don't advocate for some people to get special resources and others not. And so really being able to argue that from an equity perspective, some resources need to be targeted as well, for everyone to be healthy and safe. So I know that didn't answer your question, Heather, about our study, but I don't want to take up more time either.
Yeah, that's okay. We can come back to that if we have time. We do have a few questions here. So Julie, do you want to ask your question to Dr. Ibrahim or to other panelists?
Yes, thank you. Thanks for this opportunity. I wanted to follow up on Dr. Ibrahim's comment of supporting children's creative expression and curiosity. To hear from you and other panelists about, are there particular places or experiences that you find especially valuable or therapeutic for children's mental health at this time? And while the discussion hasn't focused as much on physical health, I'm also curious about your thoughts on how best to support that during the pandemic.
Yeah, so I think there have been a few different things. I think first, physical health is very key, and I think just physically being outside, getting sunshine. Even, you know, I've been encouraging just even family walks if that is safe to do in a neighborhood where it's socially distanced. I think that's been really, really important. I've been appreciative about how many schools have continued to do physical education, you know, in a different format of but virtual physical education where kids are up and out of their seats, they are singing, they are dancing, they are doing some kind of expression during their school day, and having that is scheduled for them specifically as a part of their school day, I think has been really helpful. And I've been checking in to make sure that many schools are doing that, because it's really important. I think art and art expression is another very key thing, especially in the younger kids. You know, at least the Seattle Public Schools and several other schools have been really intentional about sending supplies home so that kids are able to participate in art class. And I think art therapy has been shown to be really effective for kids' expressions. Expressions of how they are feeling about certain situations, are able to draw a picture and then help explain that. So I think art expression has been another thing that I have found that kids have, one, enjoyed, but two, it's a nice talking point for parents as we are at home with our kids all of the time, for them to kind of bond over a specific you know, art drawing that they did, or being inquisitive about, you know, what can you do. I think science is also another thing where many kids have been doing kind of like small videos, whether on YouTube or that their teacher sends them, where they are able to use things at home. They don't need fancy things, but, you know, things at home, what happens when you add these two home products, what, you know, happens there. And I think, you know, what could be key in that is actually also supporting parents and saying, here's how you can engage with your kids as they're creatively expressing themselves. Because many parents haven't been given the tools in how to engage kids, especially kids who have been at home, not seeing their teachers, not seeing family members, not seeing other friends for a long time.
We have a question from Anna that's for Dr. Tajima. During the pandemic, the ability to observe and report suspected child abuse and neglect has declined. Are there any innovative solutions in Washington to address this? Will the future include more virtual ways to report abuse in the home?
Yeah, it's a good question. We certainly have seen that with the pandemic, and particularly when schools closed, that rates of child abuse reporting dropped significantly in Washington state. I believe it dropped about 50%. And you know, among educators, it sort of dropped out the way it does in the summertime, in the summer months when they're not seeing children. And I think it dropped in general among mandated reporters as well. I'm not aware of particular innovative programs yet in Washington state. I think it's all somewhat new and in development now, but I've certainly seen guidelines for educators around sort of what to look for, how to think about hearing from children in a more private setting. You know, one of the things that we lose when children are not in school, you know, is the opportunity for a child to stay back in class and talk with a teacher in private. And on Zoom or whatever the online platform is, there's just very little privacy. There may be somebody right next to them. They might be in the next room, but you know, there are, I think, ideas for educators to gauge how students are doing, trying to you know, see if they're seeing signs of students being withdrawn or fear, or, you know, I think, and I think also with telehealth, there's likely to be more guidelines about how to detect things that might be concerning virtually. So I think we'll see more information about that come out, but I'm not aware of any particular programs. But I just think the way that we've been talking today about really prevention, I think we can just assume that the stresses are there and the increased risk is there, and just think about what supports are going to be needed in general. But it's a great question.
Yeah, I actually wondered kind of the flip side of this question, which is that there's quite a bit of evidence on the bias, particularly racial bias, that's inherent in the reporting system and in the system's sort of response to reports. And I wondered if you saw any opportunities perhaps for that to actually improve, with certain families not being, nearly as sort of surveilled, if you can use that word.
Mm-hmm. Mm-hmm. Yeah, that's an excellent point. I think what I was talking about at the beginning about sort of a reckoning with systemic racism in institutions extends to child welfare for sure, because there's hundreds of years of systemic racism that's evidenced in the child welfare system. And we see disproportionality at every stage, including at the reporting stage. Reports sort of is one level. At the next level, then it's those that are screened in. In other words, they meet some basic criteria, and then after that, they're investigated and determine whether or not it's founded. And so, there's different sort of dynamics at play at different points. But it is potentially a way to think about it, about families that are sometimes over surveilled because of their connections to different systems, whether it's education, medical, or social services, or others, where they're encountering mandated reporters in particular, and where people are reporting, driven by some of their own biases, implicit or otherwise. So it may be that there is less surveillance. And I do think, as we think about rethinking child welfare, we're also thinking about kind of moving away from that policing, law enforcement, surveillance, and legalistic kind of an approach to one that is, more supportive, more voluntary, and less punitive, and less legalistic. And I think that would be welcome.
I think we have time for one more question from the audience, if anyone has a question in mind. Or if any of the panelists have thought of something that they haven't had a chance to communicate. If not, I'd like to thank our panelists for taking the time to share their expertise and to talk with one another. And thank everyone in the audience for joining us and engaging in this conversation. And thank you, Maria, as well, for organizing.
Thank you for organizing, bringing us together. I appreciate it.
Yes, a big thanks to Heather. We appreciate all your work. Okay, well, thank you everyone for attending. So we'll see you next week for the lightning talks. Take care.